Good morning, everybody, and this is DMA's Hacks, and we are talking about the PSM today. So, speaking about the PSM, one of the very high yielded topic in terms of a paper one of your FMGE, where you may expect to see at least once in a five questions or one in a four questions will be from the PSM. So, quite a high yield areas where we have a certain focus. So our past analysis showed that most of the questions has been coming from the communicable and non-communicable diseases, which was technically occupied 20% of your previous year Q bank. And then you have the general concept and national policies contributes the second major one, and then you have the other areas. So the main area of topics we have divided into five sections. One is your epidemiology and biostatistics, communicable diseases, non-communicable diseases, and healthcare systems. And healthcare system, these are the five major divisions we have classified, while the rest of all could be the, like a low yield areas, or rather like you can expect a very least amount of questions. So speaking about the first section, the epidemiology, people. How are we going to classify the epidemiology? So the first one is your measures of your disease frequency, where you focus on the incident, prevalence, and mortality rate, which are quite important. And then study designs are pretty important, like like cross-sectional study, case control study, cohort study, environmental study, and all those things. That the pattern of studies are very important. And then you have the outbreak investigations. So what are the steps involved in investigating an outbreak, including a case definition, hypothesis generation, and testing of the hypothesis, and all these things, the pattern of the epidemiology and the tools we uses for the epidemiology, and then the studies we uses in the epidemiology. For example, like descriptive studies and experimental studies, and the descriptive studies what type, and experimental studies what type, and observational studies what type, and what are the important things, what are the tools we uses for epidemiology. For example, rate, ratio, and proportion. What mean by rate, what is meant by ratio, and what is meant by proportion, what type of parameters can be calculated from what type of study, the strength of association of each study are pretty high yield one. And important examples of the study are pretty important one that you should not miss. That covers the epidemiology section. And then you have this biostatistics, people. Speaking about the biostatistics, you have to focus on the data analysis and sampling techniques. So speaking about the data analysis, so you have to know about the various tools of your biostatistics. For example, like what is a bar chart, what is a flow chart, and what is mean by the dotted map. All of these various tools and various like methods for the analysis, and then or marking of data. And then you have this what type of data can be obtained from what type of this tools. And then you have this some test in the biostatistics and some calculations in biostatistics. What is a positive skew distribution, negative skew distribution, and what are the speaking about the tools of biostatistics, what is a mean, median, and mode. All those things you will be seeing in the biostatistics. And apart from that, you may have the regression analysis, while linear and the logistical regression, and they're used in the like analyzing relationship between the variables. So calculation of variables and analyzing the differences between the variable are the type of questions that may ask you for the FMGE. But speaking about it, till now the questions in biostatistics would more or less be like they give you a tool and they will ask you what type of data is it, a qualitative data or quantitative data can be obtained from this type of a given tool of your biostatistics. For example, like they give you a bar chart and they ask you what type of details can be obtained from that. They give you a plotted graph and they ask you dotted graph, and then they ask you like what are the data can be obtained through this. So this type of questions they may ask you here. Okay. And apart from that, you have a communicable disease, you have an infectious agent, disease control strategies, and immunization. Speaking about the infectious agent, the common infectious agent including the bacteria, virus, parasites, and the like mode of transmission. All the communicable diseases covers the like important areas in the microbiology. We discussed that in the microbiology. If you want, you can watch the video of your microbiology to understand more about the areas which has been asked in the communicable disease. So speaking about the communicable disease, what are the available communicable diseases we are having in our society, and what organism that is causing it, and what type of preventive measures that we can take in order to prevent that communicable diseases, and what are the initiatives we have taken till now, and what are the how many diseases we have eliminated, what are the vaccination schedule. Everything will be covered in this area. Okay. And then, like a non-communicable diseases, speaking about the non-communicable diseases, what is the government measure to prevent this non-communicable diseases? What are the steps we have taken in order to prevent this non-communicable diseases? What are the non-communicable diseases we are having, and how to approach each diseases has been given. And the very important things to cover in the non-communicable diseases is number one, CAD, and number two, uh, we can we can continue with the like a CAD, and apart from that you may have a diabetes and a hypertension you have to remember. Okay, and apart from that you may have this health system. The health systems are pretty important, like organization and management of healthcare are pretty high yield area. For example, like you may expect to see the questions like how many CHCs should be placed, or how many PHCs should be placed in a one particular population, how much amount of population is required to place a PHC there, CHC there, sub-center there, and what are the number of staffs who have been there, and what is your role in a PHC or CHC, and then like what is the role of a specialist in CHC, and what is the other systems, like what are the government policies exist in this community, and how are you executing this government policies in a particular country, what are the preventive measures, what are the educational measures you take in the community. So the management strategies and the health system, understanding the health system will help you get a high scores in FMG, because like a lot and lot of questions are coming in this section. For example, like what is the salary of ASHA, or what are the incentive given to the ASHA worker in terms of your JSSK or JSY, and the DOTS incentive, these type of incentive measures, qualification of ASHAs, and number of CHCs and PHCs, and like a district education, village education, in terms of your adolescent health are pretty the areas of interest nowadays. So make sure you know everything about the health system in India, because India want to testify you. So speaking about the FMGE, this was not covered in your MBBS portion, but the government, if you want to work in India, the government expects you to understand, government expects you to test the knowledge regarding whether you have understood the policies of India, whether you can sustain here or not. So for that, this healthcare system is a very important topic. So they test you with a lot of questions in this area or in this region, so that you can able to you can able to prove yourself that I'm competent enough to work in India, because I know the policies here, I know the rules here, I know the healthcare system here, and I will expose here, and I can able to manage all the things here. This is what the entire ideology of FMG, where most people fail to notice, and they talk about the subjects all the time. So you have to prove that you are competent enough for FMG. In order to do that, they attest you a lot with the Indian policies and the current trends which is going on in India, or triggers some healthcare emergencies in India. For example, like the COVID, the alcohol consumption, and mucormycosis, and you have this government policies. What are the initiatives taken by the government? For example, like JSY, JSSK, midday meals program, and how the government is executing it, and the vaccination schedule, what type of vaccine which has been placed on what type of, what type of a container, or what type of a storage area, and then what are the names of the institutions of India, and what are they doing exactly, and where they are located. These important things you have to remember. The government will test you this. For example, like a National Institute of Virology, which is located in the Pune. Whenever you send a stool sample to analysis the polio, that's the time, you send the stool sample to the virology, which is present in the Pune. So this type of questions you may expect in the healthcare system. And speaking about it, the low yield areas of your PSM, that could be more or less like, environment and health, air, water, and what type of criteria they had designed for the, like a house, to build a house, to build a school, or to build a commercial areas, what type of, the requirements that you have to know. In terms of a health perspective we are talking about. And apart from that, we need to talk about the demography of your world. Those are demographic cycle, and what state the India is in, what is a crude birth rate, what is a crude death rate, and what are the other parameters which can assess you, what parameters use you for to assess the social burden of the disease, and what is the importance of net fertility rate, and what is the importance of your under 5 mortality rate, are pretty important high yield things you have to know. These are out of those 5 major sections, but like healthcare system, environment and health, communicable and non-communicable diseases, and epidemiology are the 4 major divisions that you have to cover in terms of your PSM that you should not miss at all. So with this, we are completing the PSM. So technically speaking, you will PSM, like half of the microbiology part and a half of the society part and a half of the epidemiology part. You may cover this PSM in total. This is a strategy to approach the PSM. A lot of people used to say like there are a lot of facts there, I couldn't able to remember most of them. So how to remember most of them? Because like a disease correlate with the disease. For example, you are studying about the TB and you have to revise about that, RNTCP or National Tuberculosis Elimination Program, and you talk about all the criteria that the government initiatives regarding the TB while you study the Mycobacterium tuberculosis and microbiology. This is the way to approach PSM, people. So you integrate it, it will be a very piece of cake for you. If you don't integrate it, it will be a very tough job for you. So anyway, with this we conclude our PSM section. Thank you for watching the video, and we will see you with the new subject now.